The Amazon rainforest, a vast expanse of biodiversity, is often celebrated for its unparalleled variety of flora and fauna. This lush green paradise, stretching across several countries in South America, is home to countless species that are yet to be discovered. However, beneath its dense canopy, the Amazon now harbors a troubling secret. Scientists have recently made an alarming discovery in the Brazilian state of Roraima. This region, known for its rich biodiversity, is now the epicenter of a significant health concern. Researchers have identified the co-circulation of two dangerous viruses, Mayaro and Chikungunya. Both viruses are known to cause severe illness, and their simultaneous presence in the same area is unprecedented. This discovery has sent ripples of concern through the global health community. Experts are now scrambling to understand the implications of this co-circulation and what it means for the future of public health in the region. The coexistence of these two viruses, both capable of causing debilitating illness, presents a significant threat to the health of the Amazonian population. The discovery was unexpected and has raised many questions about how these viruses interact and spread. While both viruses are known to be present in South America, their simultaneous circulation in the same region was not anticipated. This has led to concerns about the potential for increased transmission rates and the emergence of new, potentially more dangerous viral strains. The co-circulation of these viruses raises several critical questions. How did these viruses come to coexist in the same region? What factors are contributing to their spread? And most importantly, what can be done to mitigate the risk of a larger outbreak? The situation underscores the urgent need for enhanced epidemiological surveillance in the region. Researchers are now working around the clock to monitor the spread of these viruses and to develop strategies to contain them. The implications of this finding extend far beyond the borders of Brazil. The Amazon rainforest, often referred to as the lungs of the planet, plays a crucial role in regulating global climate patterns. Any disruption to this delicate ecosystem could have far-reaching consequences. The health of the Amazon rainforest is inextricably linked to the health of the planet. This vast expanse of greenery not only provides a habitat for countless species, but also plays a vital role in absorbing carbon dioxide and producing oxygen. A surge in infectious diseases in this region could have far-reaching consequences. The spread of these viruses could lead to a decline in the health of the rainforest, which in turn could impact global climate patterns and biodiversity. The discovery of the co-circulation of Mayaro and Chikungunya viruses in the Amazon is a stark reminder of the interconnectedness of our world. What happens in the depths of the rainforest can have ripple effects that reach far beyond its borders. It is a call to action for the global community to come together to address this emerging threat and to protect the health of our planet. The co-circulation of Mayaro and Chikungunya viruses presents a formidable challenge for healthcare providers in the Amazon. These two viruses, both transmitted by mosquitoes, are often found in the same regions, making it difficult to distinguish between them based solely on symptoms. Both viruses share similar symptoms, including fever, joint pain, and rash. These overlapping symptoms can make it nearly impossible for healthcare workers to identify which virus is causing the illness without advanced diagnostic tools. This overlap in clinical presentation can lead to misdiagnosis and delayed treatment, potentially exacerbating the severity of the illness. Misdiagnosis not only affects the patient's health, but also complicates public health efforts to control the spread of these viruses. The co-circulation also raises the specter of co-infection, where an individual is infected with both viruses simultaneously. Co-infection is particularly concerning because it can lead to more severe symptoms and a longer recovery period. Co-infection can lead to more severe disease and complicate treatment strategies. Patients with co-infections may require more intensive care and longer hospital stays, putting additional strain on already limited healthcare resources. In a region with limited healthcare infrastructure, such as the Amazon, the co-circulation of these viruses threatens to overwhelm healthcare systems. The lack of resources and medical personnel makes it difficult to provide adequate care for all patients, especially during outbreaks. Accurate diagnosis is crucial for effective disease management. Without knowing which virus is causing the illness, healthcare providers cannot administer the appropriate treatment, which can lead to worse outcomes for patients. However, in remote areas of the Amazon, access to sophisticated diagnostic tools is often limited. This lack of access means that many cases go undiagnosed or are misdiagnosed, further complicating efforts to control the spread of these viruses. This lack of diagnostic capacity hinders efforts to track the spread of these viruses and implement timely control measures. Without accurate data on the prevalence and spread of Mayaro and Chikungunya, public health officials cannot develop effective strategies to combat these diseases. Community health education programs are essential in these regions to help people recognize symptoms and seek medical care promptly. Educating the public about preventive measures, such as using mosquito nets and eliminating standing water, can also help reduce the spread of these viruses. Collaborative efforts between local and international health organizations are crucial for addressing these challenges. By working together, these organizations can provide the necessary resources, training, and support to improve healthcare infrastructure and response capabilities in the Amazon. There is hope that advancements in diagnostic technology will eventually make it easier to distinguish between Mayaro and Chikungunya infections. Portable diagnostic tools and rapid testing methods could revolutionize the way these diseases are managed in remote areas. Building a resilient healthcare system in the Amazon will require sustained investment and commitment from both local governments and international partners. With the right support, it is possible to improve healthcare outcomes and reduce the impact of these co-circulating viruses on vulnerable populations. Mayaro virus, a lesser-known relative of the chikungunya virus, is an emerging arboviral threat. This virus, though not as widely recognized as some of its counterparts, poses a significant risk due to its potential for widespread transmission and the severity of its symptoms. Transmitted primarily through the bite of infected Aedes mosquitoes, the same vectors responsible for spreading other dangerous viruses like dengue and Zika, Mayaro virus causes a febrile illness known as Mayaro fever. This illness is characterized by symptoms such as high fever, severe joint pain, muscle pain, headache, and rash. Symptoms of Mayaro fever closely resemble those of chikungunya, often leading to misdiagnosis. Both diseases cause debilitating joint pain that can last for weeks or even months, significantly impacting the quality of life of those affected. While Mayaro virus has been circulating in South America for decades, it has largely remained under the radar of global health authorities. Historically, the virus has been confined to sylvatic cycles, primarily affecting animals in forested areas. These cycles involve the transmission of the virus between wild animals and forest-dwelling mosquitoes. However, in recent years, there has been a growing number of reported cases in humans, indicating a shift in the virus's ecology. This shift suggests that the virus is adapting to new environments and hosts. This ecological shift is likely driven by several factors, including deforestation and increased human encroachment into forested areas. As natural habitats are destroyed, mosquitoes and other wildlife are forced to move closer to human settlements. Deforestation, in particular, plays a significant role in the spread of the Mayaro virus. As large swaths of the Amazon rainforest are cleared for logging, mining, and agricultural activities, the delicate balance of the ecosystem is disrupted. As humans venture deeper into the rainforest for these activities, they come into closer contact with mosquito vectors carrying the Mayaro virus. This increased interaction between humans and infected mosquitoes heightens the risk of virus transmission. In deforested areas, mosquito populations can thrive due to the abundance of standing water and the lack of natural predators. These conditions create ideal breeding grounds for mosquitoes, further exacerbating the spread of the virus. This increased contact facilitates the spillover of the virus from animals to humans. Once the virus makes the jump to human hosts, it can spread rapidly, especially in areas with high mosquito densities. Once introduced into human populations, the virus can then be further spread through human-to-human transmission, particularly in urban areas where mosquito densities are high. This urban transmission cycle can lead to outbreaks that are difficult to control. In urban areas, the high density of mosquitoes and the close proximity of human dwellings create a perfect storm for the rapid spread of the virus. Public health measures, such as mosquito control programs and public awareness campaigns, are crucial in preventing and managing outbreaks of the Mayaro virus. Efforts to control mosquito populations, such as eliminating standing water and using insecticides, can help reduce the risk of transmission. Additionally, educating the public about the symptoms of Mayaro fever and the importance of seeking medical attention can aid in early detection and treatment. Research and development of vaccines and antiviral treatments are also essential in the fight against the Mayaro virus. scientists are working tirelessly to understand the virus's behavior and develop effective countermeasures. Global health organizations are closely monitoring the situation, ready to respond to any potential outbreaks. The collaboration between governments, researchers, and public health officials is vital in addressing this emerging threat. While the Mayaro virus poses a significant challenge, there is hope that with continued vigilance and proactive measures, we can mitigate its impact and protect vulnerable populations from this emerging threat. Unlike the relatively obscure Mayaro virus, Chikungunya virus is a more familiar foe, having caused widespread outbreaks globally. First identified in Tanzania in 1952, Chikungunya virus has spread rapidly in recent decades, reaching epidemic proportions in Africa, Asia, and the Americas. Chikungunya is a debilitating disease. While rarely fatal, it can cause severe joint pain that can persist for months or even years after the initial infection. This chronic pain can have a significant impact on quality of life and economic productivity. The co-circulation of chikungunya with the Mayaro virus in Roraima raises concerns about the potential for a resurgence of chikungunya cases. The presence of two similar viruses circulating simultaneously could lead to increased surveillance challenges, diagnostic confusion, and a strain on healthcare resources.
If you find this content useful, support us with a like and subscribe to the channel, and activate the bell button to receive our new videos.